Certainly caught our attention here on Happening Now. A nonprofit organization is offering free plastic surgery for kids who are the victims of bullying. One teen took the group up on the offer, saying she was taunted since the first grade because of her ears. And now she feels better about herself and is ready to face her bullies. But is going under the knife really the answer for these kids? Dr. Keith Abloh is a psychiatrist and member of the Fox News Medical A-Team. Dr. Michelle Yagoda is a plastic surgeon. Welcome to you both.
Thank you.
Dr. Abloh, is this a solution or is this a cop-out?
Well, I don't think it's a cop-out, Jenna. You might be surprised to hear that from a psychiatrist. I think self-esteem does have to come from the inside out. But listen, why work against things that are causing you to be taunted and teased? Kids can be cruel. And this, to me, is no different than, listen, if you had teeth that were in several different directions, most parents, many of them, if they have the money, they get their kids braces. Even if there isn't a problem with their bite, they do it for cosmetic reasons. No different with ears. I don't see the big issue here. It's fine.
That's interesting. I was one of those kids with the teeth that were going out all different directions. 8 years of braces here.
And
just
look
for
at
the
you
record.
now.
Yeah, right. I don't know if look at me now is right. That could go a lot of different directions.
Talk about revenge. Wow.
Dr. Yagoda, is it safe, though? Is it something that's safe for a child, let's say of 12 years old, to do something like fix a nose or fix their ears? Is that something that is good for their bodies?
Well, the answer actually depends on the area where the problem is. So for the ears, you could have this, a child could safely have the surgery after the age of 6 when the ear has reached 95% of its adult size. Noses, however, continue to reach adult size through puberty. So doing a surgery on the nose at age 12 might be premature unless the child's gone through puberty early.
It's interesting, just in perspective for us, Dr. Yagoda, because the nonprofit that we mentioned, Little Baby Face, they're very explicit on their website that they're dealing with deformities. So, for example, some of the photographs they show is a child that was born without an ear, something that's very severe that they have to fix, not something like, listen, my nose is a little big for my face right now. So as a doctor, where do you think you should draw the line? If you think you're okay with this plastic surgery, where's the line drawn?
Well, I think the question really isn't whether the child can have the surgery safely. It's whether a child is entitled to this kind of surgery and whether an organization should pay for the surgery. And cosmetic procedures really tend to be procedures that are available to patients who can afford to pay for them. But in this case, if an organization can raise enough money to offer that to patients who can't afford to it, far be it for us to judge whether or not that's something that a doctor should offer. In fact, with the economy and the healthcare system reimbursements the way they are, I think it's commendable that doctors would offer their services for free.
But Dr. Abloh, what about the message? Do the bullies win here because someone's bullied so badly that they feel they have to go under the knife to fix themselves for those same bullies?
Well, a couple of things here. Number one, I have no tolerance for bullies. So you got to push back against these bullies regardless. That's the schools, and they've dropped the ball again and again and again in controlling bullies. But look, kids are vulnerable. Here's what I'm here to say. As a psychiatrist, the toll of being bullied because of your facial appearance, if it is sadly disfigured in some way or in a way that catches the attention of these bullies, the toll can be so severe that you got to intervene if you can, because we can't change the whole world. And if it's your kid who's going to be sustaining this psychological injury, why put them in the line of fire?
Well, so that they become strong, decent people that understand that they deal the cards that they're dealt with. That would be the argument. I put this out over Twitter. A lot of our viewers feel that way.
If everyone felt that way, there wouldn't be any contact lenses, there would be no makeup, there wouldn't be nice clothes. So it's easy for people to say that. It would be easy for people to. It's easy for people to say that unless it's their kid.
Dr. Yagoda,
and then people change their tune all of a sudden.
A quick thought from you as well on this?
Well, I agree. If the surgery is safe and the child is ready for it mentally and physically, then the scars from the surgery heal in just a few weeks. But the emotional scars from repetitive bullying can last a lifetime and affect self-confidence.
Very interesting conversation. You scared me with that no makeup bit, Dr. Abloh. What would I do on air?
You'd be fine.
Yeah, right.
That's the truth.
I don't know. Dr. Abloh, Dr. Yagoda, nice to have you both today.
Thank you.
And for
take care.
For the record, I have never teased you because of your orthodontia. I never knew you had braces for 8 years.
For years.
Really?
Yes. I needed them for a lot of different reasons, cosmetic and otherwise. I wouldn't be able to speak. What would happen then? Where would I be? Dr. Abloh is right.